This being Washington, I should start out with a phrase that some of you may remember from the 1992 campaign. A third-party vice presidential candidate got up at the beginning of the vice presidential debate and said, "Who am I and what am I doing here?" That question was never fully answered. But in my case, the question of both who I am and what I'm doing here goes back to my own roots as a practitioner and a field person working in global health. And in fact, exactly 25 years ago, in April of 1985, I was out in a very remote area of western Nepal, starting the first field investigations of the project that ultimately came to look at community-based management of childhood pneumonia. It was an interesting place, not unfamiliar to many of you who are experts in global health. No roads, no electricity, virtually no literacy, very high death rates, both maternal and child. And one area which not only was not being addressed in Nepal, but was not really being addressed globally, was the enormous toll of childhood pneumonia. We thought we knew what we needed to know in order to act for childhood pneumonia, but what we knew was that you had to have doctors, you had to have stethoscopes, you had to have x-ray machines, you had to have laboratories to do bacteriology, sensitivity, you had to have multiple drugs to treat the different kinds of pathogens. And the practical realities are that those things are simply not available for probably 2 billion people on the face of the earth. Exactly those people who face the greatest toll of childhood pneumonia and all the other diseases of global importance. So in this program, we began to find out what had to be done. And the first step on that was diagnosis. The diagnosis of knowing when a child has pneumonia without all of those high-tech, high-resource, and logistical issues. And research work that had been done in the highlands of Papua New Guinea indicated that one thing you could do is to count the child's respiratory rate. Seemed very simple. And so we said, okay, let's start with respiratory rate as the diagnostic. Well, there's a problem with that. Certainly in Western Nepal and in many parts of the world, people run on watches and they don't have timepieces. So right away, in dealing with a fundamental problem in global health, we were faced with a technological gap. How do you tell time? We could buy digital watches, but digital watches had Western alphanumeric characters, and on top of that, they were enormously valuable assets in a very poor society, so they wouldn't last very long on the risk of a healthcare worker. Ultimately, we took a first step by developing a little sand timer that we had manufactured in India, but the sand for long time got wet, and there were all kinds of problems. It's hard to look at a child's chest and not have to breathing while trying to look at a sand timer at the same time. So we wound up going to Hong Kong and actually having a little digital timer where you push the button and it beeped at you 30 seconds later. So simple technology. It took us 9 months to start this process and to get something that was a viable prototype. When we had that, we had the first initial key tool for diagnosis. And in fact, I won't go into the details, but it turned out to be both appropriate, effective, and very useful. And that goes to the heart of technology. If we already knew everything that we need to know to save lives and to prevent disease, there wouldn't be any need for an organization like this or a meeting like this. But it's very clear, particularly with the launch of the Obama administration's Global Health Initiative and the $63 billion commitment that will be spent over the next 6 years, which I would note is more than doubling of the prior level of resources for global health, that we need better tools as well as bigger and better programs. What's at the heart of the initiative? I'm sure you're all familiar with the term of child health. A new re-emphasis on reproductive health, global infectious diseases, and all of it based around a couple of principles. The principles are these need to be women's human-centered, and I trust I don't need to make that case in this room, that women are at the center of their households, their family lives, and their communities. Also, things have changed since I was last in Washington in a government position more than 10 years ago, in the number of agencies that are deeply involved. We've touched on those. The Department of Health and Human Services, back in the 90s, had some peripheral interests in global health. But I think it's safe to say that at this point, the department and its various agencies view global health not only as a very important issue to be engaged with, but as an issue that's critical to the health of the American people. And so, from Secretary Sebelius on down, the heads of the Centers for Disease Control and Prevention, the National Institutes of Health, the Food and Drug Administration, even such internal operating agencies as the Health Resources and Services Administration and the Substance Abuse and Mental Health Services Administration are all deeply involved in global health.